Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and today our special patient is Allison Smith. Allison is a massage therapist here at Alcoa Chiropractic. Welcome, Allison.
Thank you.
What's going on with you today?
My biggest complaint would be my neck and just having nausea from neck pain, and anytime I use my neck, it's kind of uncomfortable.
So she was explaining to me that anytime she finds herself using her neck too much, it turns to discomfort and actually nausea that lasts majority of the rest of the day, right?
Yeah.
How long have you noticed this going on?
Probably about 4 years now. So I was in a car accident that I T-boned somebody else, and it caused whiplash, and mostly pain comes from the front of my neck now.
Okay. And you've told me in the past that you feel like your neck is like another core, right? Core meaning kind of down here where you get your stability and control from. You feel like your neck produces another core, and not in a good way.
Right. Push-ups, pull-ups, bench press, anything kind of using the chest. I tend to flex my neck and use that more than my chest almost. And that I don't work out upper body anymore and tend to avoid anything that uses chest and neck to do anything.
You're in training right now for actually a fitness event, is that correct?
Yeah.
What is that?
It's a Tough Mudder.
Okay.
And it's a lot of upper body and lower body workouts.
Okay, so that must put you through lots of ups and downs with your neck, with your nausea, upper body, and stuff like that. When is your event?
It's in 2 weeks from now.
Okay, so we got to get you strong and being able to engage through your upper body without causing negative things, right?
Yep.
Okay, so given Allison's long history of neck discomfort and that nausea sort of thing, we checked her out with her x-rays and her physical exam. She definitely had a little bit of reduced motion with the neck in pretty much all the ranges of motion, and then you could see during her push-up it was very uncomfortable and just overall difficult for her to do that. With the x-ray we saw a little bit of decreased neck curvature, but no crazy abnormalities or degeneration spots or anything like that. So I don't see any reason why she's not going to do very well with treatment here. So let's get going. Here's the best part. The camera right in the face. How often do you get massages for your neck?
Me?
Yeah.
Every 3 weeks.
Every 3 weeks?
Yeah.
Do you get them here or do you get them off-site?
No, I go get them somewhere else.
So I'll just do a little soft tissue stuff. Release your scalenes a little bit. A lot of times those scalenes, when people have the kind of like this neck core thing you're talking about, the scalenes are a big part of that.
Yeah, it's really tight.
I would say not too terribly bad as far as muscular tension in the area. Pretty good.
Okay.
Okay. The right side where the occiput and the C1, that top vertebrae, are, there's just a little bit of restriction compared to here. This moves very free and easy. Over here, it's just a little bit limited. Do you feel that?
I feel that in my everyday life sometimes.
Yeah. Okay, so we're going to adjust that.
Okay.
All right. Let that. Good. Had to fight for that one. Okay. A little bit better. All right. I'm going to do some muscle testing on this side. Okay, so tilt your head over here, shrug your shoulder up, what I'm going to do is muscle test where I push your head and your shoulders away from one another. Resist that pressure. Okay, and that was a little difficult. Let's do it over here. Shrug over here. Pushing away. Do that one again. Ready. One more time. Ready. Well, I still think it's weaker on this side than this side. Would you agree with that?
Yeah. Moved quite a bit more than that.
Yeah. So I'm going to get right in the mid-cervical region, kind of C3, C4. We'll get that. Ready. Very good. Okay. Tilt over here, shrug up there. Pushing away, don't let me. And look at that. That's a lot stronger, right?
Yeah, it is.
Okay, good. Now, okay. Make a fist. I'm going to push your elbow down, don't let me. Really strong. Put your thumb and your pinky together. I'm going to pull those apart. Don't let me do that. Ah! Not so good. Okay. So, I'm going to adjust very low on your neck, kind of that T1. Feel what it's like on this side. Yep. Okay. Thumb, pinky, pulling apart. A little bit stronger. Relax your hand. A little bit of wrist cavitation. Hey, are you going to the continuing ed thing this weekend?
No, I'm not a
Pulling apart.
CTA just yet. Ooh, look at that.
Way stronger, right?
Yeah.
Okay. Elbow in at your rib cage. I'm going to pull like that.
Okay.
Don't let me do that. Ready? Great. Make a fist. I'm going to push down towards you. Don't let me. Great. Now, I'm going to push this away. Don't let me do that. Again. Okay, so that's pec major. Pretty weak, wasn't it?
Yes, it was.
All right, good. So, pec major is what just tested weak. Relax your arm. Relax it.
Oh, relax.
Good, there you go. So, I'm going to grab where your clavicle and your sternum meet. This is called the sternoclavicular joint. And yeah, it's nice and tender, so I'm going to adjust it right there, okay? Right there. Great. Super fun, huh? Hold it right there. I'm going to push out that way. Don't let me. It's stronger, but not all the way. So I'm going to go a little lower on the sternum where some of the ribs meet you. That guy feels terrible, right?
Gosh. Yeah.
So I'm going to adjust that. I will tell you, this feels way... Let it go. Good. It feels way more comfortable on the drop tables when it drops underneath. The purpose of that drop is when I punch you, basically, like I did, force is absorbed into that drop. So it ends up being much more comfortable for you. For now, we're not using that.
Yeah.
Arm straight, pushing out that way. Better, not all the way. Tell you what I'm going to do is just a little myofascial work on your pec minor. So just trying to find for the high tension spot within your pec. And now we'll go pec major. A little bit there, huh?
Yeah.
One more. Okay. Hold it right here. Pushing out that way. Not quite there, is it?
No.
Interesting. Okay, hold your arm right here. I'm going to push down. Resist. Definitely weak. I'm going to adjust your shoulder real quick.
My elbow kind of catches right there.
Yeah? Think it hurts?
Yeah.
Hold it right there. Straighten your arm. Pushing down. Nope. Okay. Straighten your hand. I'm going to pull towards me. Don't let me. Good. Pushing towards you. Don't let me. Again. Elbow, huh? Did it hurt at all?
When it catches, it's not painful, but it's not comfortable.
Bend your wrist. I'm going to push towards you with your forearm. Resist that. A little weak. Extend. I'm going to push towards you. Resist that. A little stronger. So, all right. Bend here. Pushing towards you. A lot stronger, huh?
Yeah.
Straighten your hand. Pushing towards you. Good. Hold it right here. Pushing down. Better. Pushing out that way. A little better, huh?
Yeah.
Cool. Make a fist. I'm going to push down, resist. Good. Thumb and pinky pulling apart. Ah!
Gets me every time.
Yeah. Okay. Thumb and pinky pulling apart. Much better. Okay. Elbow in its rib cage. I'm going to pull your elbow that way. Resist that. Again. That's fine. Make a fist. Pushing down towards you. Great. Pushing out that way. Same deal. So, does the right elbow catch?
I think it has before, but
Not nearly at the same.
Maybe once or twice.
Okay, then we'll go into. Okay. Drop your elbow down. Let that drop down. Good. Hold it right there. Pushing that way. Already strong. Hold it right there. Pushing down. That's not good. Bend here. Hold it right there. Pushing down. Now. Straighten your hand. Pulling towards me. Again. Pushing towards you. Okay. Those were pretty good right there. The shoulder was not. Let me do another test. What I'm going to do is pull your elbow forward.
Push it back.
Just don't let me. Let it go there. Yep. Pulling forward. That's very weak. Okay. We'll hit that in a second. Put your chin to your chest. Breathe out. Good. Okay. Flip around on your belly. All right, that same muscle test, but from the other side. Hold your arm right here. I'm going to push forward from this direction. Resist that. And that's not easy to do, is it? Okay. Good. Hold it right there. Pushing forward. Stronger, right? Good. Relax here. All right, deep breath. Breathe out. Good. Good. We'll do lower body now. Hold your leg right here like this. I'm going to straighten your knee. Don't let me. Again. Other side. Straightening your knee. Don't let me. Big difference, right? All right. Turn on your side. This side up, facing me. All right. So your hamstring tested weak. A lot of the nerves for the hamstring come out of your L5. So that's what I'm going to adjust. Take a deep breath. Breathe out. Very good. Go face down. All right. Hold it right there. I'm going to straighten your knee. Don't let me. And look at that. Much better. Bring your knee up towards the ceiling. I'm going to push down. Really good. Knee up. Hold it right there. Pushing down. Really good. Okay. And now that you have some nice tension throughout your body, don't let this wiggle wobble and rotate your head to the right as far as you can. Good. Does that hurt? Go to the left. Good. Does that hurt? Good. Flex your head up into a flexion pattern. And down. Good. Did that bother you? Difficult, but not. Good. Okay. Now come up to the next step. There you go. Stay right there. First thing to focus on is not wobbling the kettlebell. Okay. Second thing, grip super tight. And maybe you're not, but now focus on relaxing your neck. Now focus on turning your head to the left as far as you can. And now all the way to the right, all the way looking at the kettlebell again. Good. And now keep your teeth together, touch your chin all the way down to your chest. Good. And back to neutral. And do it again, but this time in a more relaxed manner. And up to the next step. Good. All right. Same sort of thing. Grip tight. Make sure you got your whole shoulder girdle in that. Yeah. Yes. Lock out those knees. Squeeze the butt. There it is. Good. Push the heels through the ground as you stand up. Good. That's it. That's it. Okay, this was Treatment Tuesday. Allison, thank you so much. How did that whole thing go for you?
It went great. I felt like I was able to kind of separate my neck, allowing my neck to relax and allowing my body to do the work.
Good. And that was really our goal here. So you have a lot of work to do as far as practicing some of these movements to learn how to engage and stabilize through the rest of your body while allowing that neck to relax a little bit. But that's the name of the game, okay?
Right.
All right. Well, thank you so much for tuning in to Treatment Tuesday. This was Dr. Scott Hoar. Hit the thumbs up button, leave a comment below, hit the subscribe button, and tune in next week for our next Treatment Tuesday. Bye-bye.